Welcome to Bold Voices, a production of the Community Foundation of Broward, where we explore Broward's biggest issues, get to know some of the people and organizations creating a bold impact in our community, and take a deeper dive into the world of local philanthropy with the experts at the Community Foundation of Broward. And now it's time to be bold.
Thank you for joining us on Bold Voices, a production of the Community Foundation of Broward. I'm your host, Ellen Jaffe, and with me today, someone who has been instrumental in bringing mental health to our community in a huge way. Steve Ronik, CEO of Henderson Behavioral Health. Welcome to Bold Voices.
Thank you for having me. It's always a pleasure for us to talk about behavioral health care and why it's so important and how we can help people.
What is the focus of Henderson Behavioral Health?
Essentially, Henderson is the safety net, comprehensive, not-for-profit behavioral health system for Broward County. We have over 20 locations just here in Broward County.
Yeah, I was amazed when I saw that on your website, and you had your report of your most recent accomplishments and the number of people you've reached. You know, some 20,000 direct and 170,000 calls that you take in. What have you seen in recent years are the needs, particularly since the pandemic?
So mental health conditions are ubiquitous, and they've always been ubiquitous. 1 in 5 Americans have a diagnosable mental health disorder at any given time. Mental health conditions are like any other health conditions. They're just amazingly common. Now, with that said, the pandemic, particularly the first year and a half of the pandemic, for sure took a tremendous toll on people. And different people handle that in different ways, but I think even people with the best coping mechanisms, the people who are most resilient, the people who are lucky maybe to not have been afflicted with mental health conditions, even those folks, everyone felt the stress and the isolation because human beings, first and foremost, are social animals, and one of our core intrapsychic needs is basically to be around people. People are good for you. So to be completely shut off, not just from people close to you, but even from the incidental interactions we have on a day-to-day basis was just devastating for folks. For all of us, for people with mental health conditions, particularly serious mental health conditions, it was extraordinarily difficult. People who are older, my parents are a great example. They're 89 and 91. The pandemic was enormously difficult on older adults who became very isolated. But in terms of the prevalence of mental health conditions and addiction in general, they're super common, and they've been super common.
So why is there a stigma around the concept of mental health if almost everyone at some point has some kind of depression, or they lose a job and it's challenging and they don't know how to handle it? And yeah, that can fall under mental health problems or challenges. Not everyone has to be bipolar or have schizophrenia to have a mental health challenge.
That's right. Only about 3% of the population has those more very significant mental health conditions like schizophrenia, probably between 1 and 3% of the population. That's still a lot to have a debilitating, very serious mental health condition. With that said, relative to stigma, I've been doing this for a long time, and it's incredibly gratifying that the level of stigma that exists now is very small, almost none. And when I started in my career a long time ago, there was tremendous stigma, which is a big barrier. At Henderson, our true north is access, right? That's what we care about. We want to make sure we're an easy system to access and an easy system to use. And stigma used to get in the way. Not so much anymore. And particularly with young people, millennials, Generation Z especially, I don't see any stigma there.
That's wonderful.
Yeah, so things are much better, and that's also led to some better support because it's part of the American conversation now. So state governments, not just in Florida, which has been much better the last couple of years relative to funding, but all across the country, mental health funding, mental health support has become a much higher priority. Finally.
You have a lot of foundations and local community partners that help support you as a nonprofit, the Community Foundation of Broward, of course, being one. How has what the Community Foundation of Broward does to support Henderson Behavioral Health helped you reach your mission? Access for the community. You have a zero suicide strategy. How has that support made a difference to you?
Yeah, well, first of all, we love the Community Foundation of Broward County. I mean, they've been an incredible partner for a long time. The last few years, we've really gotten tied in together, got major funding from the Mary Porter Initiative, blessed and privileged to be one of 2 organizations that were funded in a very competitive funding process. We have named our outpatient building, a large building which has a census of about 1,500 patients in central Fort Lauderdale. That's now the Mary Porter outpatient building, and it's our honor to have done that. Community Foundation is also connected with a bunch of their donors, and they have targeted Henderson. In fact, one of our nursing stations in our new state-of-the-art crisis stabilization unit, we're very proud of that. We just opened it a couple years ago. One of our nursing stations is named after the Community Foundation because of major support. They're just great. But not just that, things like this, and they host roundtables on mental health and addictions, and they've been really good at promoting why it's so important to recognize that mental health conditions are out there and common and nothing to be ashamed of, and most importantly, that treatment works. We know what to do.
And we need that kind of attitude coming from our leaders.
Right.
Tell me about the zero suicide policy.
Yes, we have a zero suicide initiative, and it's a national evidence-based initiative. And it basically, in simple language, the idea is that in a healthcare system, not Henderson per se, any healthcare system, ideally, no one would fall between the cracks, and you'd have policies, procedures, practices, redundancies that ensure that once someone touches your system, they won't complete a suicide. It's hard to get to 100%. Right, but there are things that organizations can do through their electronic healthcare record, through how they communicate, how they document, flags, communication, training, instruments, best assessments that can make a difference. So it's actually a county-wide initiative now where the whole county is taking it on. In other words, multiple providers. But I believe, I'm almost sure we were the first ones. We started it a few years before it became a county initiative. So we're always trying our best.
It seems like in the last couple of years, I don't know if it's just that it's been publicized more, but it seems like there are more youth suicides and celebrities who seem to have everything. When Anthony Bourdain killed himself, Winona Judd.
Right.
And you can't fathom.
Their lives look perfect, right?
Right. And actually, that's an important message, is that no matter what it looks like on the outside, on the inside, we can feel differently than what we present to the world.
Yeah, I think when those celebrities, those were tragic deaths, and looking in from the outside, people think, well, how could this be? But, if you dug a little deeper and you looked at some of those, they could have been helped, and it didn't have to happen. So it's just incredibly tragic. If you look at Anthony Bourdain, for example, he was a very isolated guy, had an undertreated depressive disorder, had probably an active ongoing issue with alcohol, and apparently had just started to get some help, but it wasn't enough, it wasn't quick enough, and it wasn't deep enough.
Right.
But he could have gotten help, and Kate Spade too, and Judd as well. And so the issue is access, and sometimes for people that are super achievers or very perfectionistic and want everything to be right, when then something in their life becomes less than perfect and they can't maybe be or feel the way that they would like to up to their standards of perfection, the loss can be overwhelming. So the idea is you hope friends and family, right, are going to reach out and notice these signs and then point them to help, because help is there and treatment works.
In what circumstances are people staying in housing with Henderson?
So in addition to being a big outpatient, inpatient, and rehabilitation services organization, we're a big housing system. So Henderson has about 200 housing units that we own and operate directly. We also have about 400 people in supportive housing. That includes level 1, level 2, and level 3 residential treatment, which is treatment overlaid onto housing. We also have a 40-bed permanent housing single-room occupancy in Hollywood, which we did as a joint venture with HUD, with the federal government. It's beautiful. We were able to acquire a motel, a swimming pool, renovate it all. It's gorgeous, and most importantly, it's permanent housing for people with mental health conditions and who had been homeless. So housing is a big part of our DNA. In fact, we got appropriations to develop more housing, and we're actually in the process of acquiring multifamily units right now, which we will then renovate and provide very low-cost permanent housing to our patients.
We need that for everyone at this point.
Right.
Affordable housing is a huge issue. And
it sure is.
For a lot of people who are working, they're 40 hours a week, that has to also create mental health challenges when they find out, I can't afford my bills. What am I going to do? How am I going to get through this? How do I feed my kids and keep going?
Yeah.
So what you're doing is needed more than ever. And congratulations on that. I know you've won tons of awards for what you do. I'm fascinated that you're also a national research site.
Yeah, we've done a lot of research at Henderson. Henderson has been a site for a number of groundbreaking contributions to the knowledge base. Probably the two most important is, this is a long time ago, we were part of the Ed.D. trials. Ed.D. trials was the landmark study that compared first-generation and second-generation antipsychotic medications for about 50 sites across the country. We were one. Most recently, this became a very big deal for us. We were part of the RAISE research, which included 35 organizations around the nation funded by the National Institute of Mental Health. RAISE stands for Recovery After an Initial Schizophrenic Episode. And what that has led to now is what's known as first episode psychosis programs. First episode psychosis programs are where you take somebody right after they have their first schizophrenic break and you use a very prescriptive, evidence-based way of treatment. It has 4 components. I'm not going to get too deep into the weeds, but it's highly manualized. It's a 2,000-page manual, if you want to know. You can read that at some point.
Okay, I'd love to. Is it on your website?
And what it does is get a hold of someone after their first break, and the interventions that follow can stop the relapse cycle, because every time somebody has another relapse with schizophrenia, they tend to come out of it a little bit worse psychiatrically and cognitively. So if you can stop the relapse cycle, you can actually then push somebody, you can dramatically change the trajectory of the illness for the good and keep somebody on as normal a life course as possible. Schizophrenia, and it's cruel, usually emerges when somebody's just beginning their adulthood, so it can completely throw off their life course. Typically happens between, say, 16 and 35. The most common ages are between about 18 and 22. So we've had tremendous success, and actually Henderson opened up the first episode psychosis team in Florida. Now we have 3 of them. We are the largest first episode psychosis provider in Florida. But now, thank goodness, first episode teams are ubiquitous. They're all over Florida. They're all over the nation. And we were at the beginning of that due to the RAISE research.
How can someone identify when a loved one, a friend, family member, coworker is going through something or has had a first schizophrenic episode?
Right, because people don't call us and say, my son or my daughter has schizophrenia. Can you help me?
They don't know.
What happens is they call and they say, my son is acting really strange. He's very isolated. He's talking to himself. He says he's hearing things. We ask him what he's hearing. He's saying he's hearing voices. So the hallmark or some of the cornerstone symptoms of schizophrenia, are delusions where people believe something that's not true. You can't talk someone out of a delusion. They're sometimes referred to as fixed because they believe it, right? The only way to make it go away is through treatment and medication and intervention. Suspiciousness, paranoia, and auditory hallucinations is a very common symptom. So what happens is we'll get a call that their son or their daughter is acting very, very strange, not themselves, responding to internal stimuli. And then, once we get that call, our people in central receiving who get those calls, then they know, okay, based on what they're describing, we got to get this person over to first episode, and we do.
And what about when someone is exhibiting symptoms of depression, which there is apparently a lot of?
Right, so that would be more common, right? Anxiety and depression, mood disorders are the most common mental health conditions. And so with depression, what you'll see is somebody loses, first of all, they appear sad, right? But the difference between sadness and depression is sadness fades, and it doesn't interfere in a significant way with your day-to-day functioning. A depressive disorder, particularly major depression, someone will lose their appetite. They won't be interested in eating. They might lose a lot of weight. They're not sleeping well anymore. They might not be sleeping hardly at all. They become hopeless, right? So when these type of things emerge, then they won't leave the house, right? Can't go to work. You want to have intervention as quickly as possible, because the sooner we can start somebody on medication and therapy, you can get better pretty quickly.
How does someone get in touch with Henderson Behavioral Do you need a referral? Or
Nope. They can just go to the website, but the phone number's there, 954-463-0911. All the numbers are there. Mental health organizations across the country have a reputation of being complicated and hard to access. And that's not entirely untrue. Part of that is because of the way that they're funded through braided funding, multiple funding sources, different eligibility for different programs based on the payer. But that should never be the patient's issue to worry about. Right. So we work really hard. It's not stated in our mission, but part of our mission is to be an organization that doesn't give someone the runaround, to use simple language.
Thank you.
So that when somebody calls, we make it easy for them. And if we can't help them, we try to find some place that can help them.
Okay. And that website is hendersonbh.org. And I want to also give the website for the Community Foundation of Broward, cfbroward.org, where you can find information about the Mary Porter Fund, and you might find there's a fund you want to start. There might be an issue that you care about and you want support going in perpetuity, which is what they do, or that you want to make a donation to a fund that's already in place. And if mental health is something that's you're concerned with and you believe needs the support, you can support it through the Community Foundation of Broward, and also, of course, directly to hendersonbh.org, or you have a donate link. One other thing I want to touch on is your educational outreach. It's phenomenal. And you have a speakers bureau. How can someone arrange for someone to come out and speak and learn about your services and why people should not be afraid to reach out?
Yeah, they can call our organization and we can set that up. One of the things we do a few things relative to education. We have a few certified mental health first aid instructors on our team, and mental health first aid is an evidence-based way of helping somebody deal with a mental health crisis, just like we train the general public in first aid for physical conditions. Same thing. We train lay people, the general population, in what to do, how to intervene if you encumber somebody having a mental health emergency. So that's one thing. And then very often we have some of our leaders at Henderson come out. Very often we're called out to Rotary clubs, Chamber of Commerce meetings, school board meetings, even private organizations who just want some information about mental health, and we try to do that as well.
So are there just a few things that people can do, say, on a daily basis to keep themselves feeling good and keep their mental health in a positive place?
Yeah. So we know that some of the fundamental things, but I want to be careful in how I say this, because you could take the best care of yourself and practice the things that I'm going to suggest right now and still be afflicted with a mental health condition. And it's not your fault. It's just basically you might be biologically set up to have it. But with that said, yes, there are things we can do to help promote our mental health. And one of the things to keep in mind is the whole issue of isolation and socialization. So the United States Surgeon General has actually declared that loneliness is an American epidemic right now.
Wow.
He feels people are wildly isolated. Our incredible preoccupation and addiction with devices and our cell phones and our smartphones and social media has been on a lot of levels pretty destructive. People post these carefully curated stories on Facebook and TikTok and Instagram, right, about how great their vacations are in their life and their loves and their trips. And then others look at that and think, what am I missing out on? I'm not good enough. It's not me. And of course, people only tend to put the best parts of their life up there. Everybody's got ups and downs. Nobody is perfect. So I think to promote your mental health, there are some things also you should limit. You should limit your social media involvement. You should limit your screen time. And people need people. People are good for you. So it's really important, if there's one thing you can do, is to make sure you have social connections. Even if it's not face-to-face, on the phone, through Zoom. Face-to-face is the best. Nutrition is important. Try to do your best relative to nutrition. Daylight is important. Exercise is important. So all these things are proven relative to helping promote mental health, but easier said than done, right? Especially when we're not feeling good, we're less likely to take as good care of ourselves. But those are the things that help. And again, you could do everything right and still be afflicted with a mental health condition, and it's not anyone's fault. And people just get them just like they'll get any health condition. And just like if you had a health condition, you would go and get treatment. Same process, no difference.
I
And
love
earlier is better, just like with any health condition.
Okay, when is a time you have mobile access?
We have a mobile crisis team. So Henderson Behavioral Health operates the mobile crisis response team for all of Broward County 24/7, 365. And that's a team that responds to mental health emergencies wherever they are. The emergency is in the eye of the beholder, of the caller. We don't really get into whether something's an emergency or not. If somebody thinks it's an emergency, it is. And then we go out there, and the goal of the team is to resolve the crisis and then engage the person into treatment. That's the goal. Incidentally, occasionally, somebody needs to be hospitalized because they might be acutely suicidal or worse, and then we arrange for hospitalization. Also, we operate the central receiving system for all of Broward County, which is open 24/7, 365, which is like a walk-in center, urgent care arena. It's a place for law enforcement to bring people, drop folk off who they encounter who might have a mental health condition, maybe committed a crime that's a nonviolent crime. It's victimless. Rather than bring the person to jail, they know it's a result of their mental health condition and they bring them over. And actually at our CRS, we have law enforcement there 24 hours a day.
Anything else that you think people need to know about Henderson Behavioral Health and the work that you do?
Well, I think the most important thing to know about Henderson or about mental health and addiction in general is if you feel you need help, get help. Make the call. And the good news now is you don't have to call Henderson. You don't have to call a clinic. You can call 988. So we have an American crisis hotline now, and it's really a telehealth service because the person who answers the phone at 988 is a trained professional. So they're going to help you directly when you make that call, and then they're trained to link up with places like Henderson for people who need more help beyond that. So 988 is literally and metaphorically a lifesaver.
Right.
And thank God we have it now.
Okay. So the main things we need to take from this for when anyone feels that they need some kind of support, assistance, mental health treatment, if you are in crisis, call 988.
Yes.
You can also locally call 911.
You could, but really for a mental health crisis,
Call
just
988.
call 988.
Okay.
Yeah. Now, again, somebody has initiated a suicide attempt, God forbid, something like that. Absolutely. You call 911 because you need medical intervention right away.
Right.
But for a general mental health crisis, somebody's thinking about, I don't know if I can take it anymore. Absolutely, they can call 988. It's fantastic.
Okay. And to reach Henderson Behavioral Health, the number is 954-463-0911. The website, hendersonbh.org, and you will find pretty much everything you really need to know about all of the services. And as you have mentioned several times, Steve Ronik, CEO, we all can use some help at some time. And if this is an issue that's dear to you, please visit the Community Foundation of Broward, cfbroward.org. Do a search for that Mary Porter Fund and maybe consider making a contribution to it or starting your own fund. Steve Ronik, thank you so much for what you're doing and the huge expansion of Henderson Behavioral Health and the access. That's the key. Really appreciate your work here in Broward County.
Yep, you're welcome. Thanks so much for having me.
Well, I am feeling better after speaking with Steve Ronik, CEO of Henderson Behavioral Health, and Kirk Engelhardt, Vice President of Marketing and Communications. We cannot finish an episode of Bold Voices without talking to you in Kirk's Corner. There are some big anniversaries going on.
Yeah, it's the 40th anniversary year of the Community Foundation of Broward. Also, we just celebrated the 70th anniversary of Henderson Behavioral Health. We have a relationship with Henderson Behavioral Health that goes back a long time. 1998 is when we gave them their first grant from the Community Foundation. It was $5,000 from the Harold D. Franks Fund, and it supported programs focused on treating adolescents who were suffering from mental health and addiction issues. That was just the first grant. We've awarded almost 100 grants over the years to Henderson Behavioral Health, totaling well over $2 million in support. And the most recent was through our Mary Porter Fund, which actually has Mary Porter's name on their outpatient facility. The folks at Henderson years ago were thinking about how do we sustain this? How do we make this something significant that's going to last forever? And they set up an endowment fund at the Community Foundation of Broward that over the years has provided over $175,000 back to Henderson. So they were thinking endowment, they were thinking permanence, they were thinking sustainability and the fact that this is a need and it's critical and we've got to make sure that we support this so that it lasts forever.
The concept of a nonprofit setting up their own fund to support themselves is brilliant, as you said, in having finances coming in on a regular basis in perpetuity.
It is. It's something that they can count on with their bookkeeping. They know that it's a line item in the budget that's always going to be there. It does not go away. It really is the best deal in town for a nonprofit and one of the safest investments that you can make that is going to provide revenue and sustainability back to you for generations to come is through an endowment. And how lucky are we that we have Henderson Behavioral Health supporting us and the people who live here.
170,000 calls a year. So
yes.
I encourage people to make use of those call centers and go to browardbh.org anytime.
Absolutely.
A couple of the standout things that Steve mentioned in feeling good were socializing, getting some sunshine, some exercise, nutrition, and I'm going to add to that, when you do for others, you always feel good for yourself. So contact Community Foundation of Broward if you'd like any additional information, cfbroward.org.
Ellen, we've been doing it for 40 years, and I don't know of any business that lasts 40 years if they're not really good at what they do. So I have to say, and it's not just bragging, we're proud of our 40 years of service to this community. And when we can help organizations like Henderson and other nonprofits and see the results of their work and how it's changing lives, you got to love coming to work every day when that's the situation.
So true. Thank you, Kirk Engelhardt, for joining me once again on Kirk's Corner, Vice President of Marketing and Communications for the Community Foundation of Broward. We will speak again on the next episode of Bold Voices.
Thank you for listening to Bold Voices. We hope you've enjoyed this episode and hope you'll be inspired to join us in creating a better Broward for all. If you'd like more information, visit us online at cfbroward.org and remember to always be bold.